Hey there! Today, we're going to dive into a topic that many new parents often find themselves grappling with: formula supplementation of breastfed infants. It's a question that sparks a lot of debate and opinions, so let's explore whether it's helpful or potentially hazardous. First things first, let's establish that breast milk is undeniably the gold standard when it comes to infant nutrition. It's designed to provide all the essential nutrients and antibodies that a baby needs for optimal growth and development. It's no wonder that organizations like the World Health Organization and American Academy of Pediatrics recommend exclusive breastfeeding for the first 6 months of a baby's life. However, we also have to acknowledge that breastfeeding isn't always smooth sailing for everyone. Some mothers may struggle with low milk supply, latch issues, or medical conditions that make breastfeeding a challenge. This is where formula supplementation comes into play, as it can provide an alternative source of nutrition for babies in need. For these mothers, formula supplementation can be a helpful tool to ensure their babies are getting the nutrition they need. It can help bridge the gap between breast milk supply and the baby's demand for food. It can provide peace of mind for parents who may be worried about their baby not gaining enough weight or thriving as expected. Additionally, formula supplementation can also offer some flexibility and practicality that breastfeeding alone may not provide. It allows other family members to participate in feeding duties, giving mothers some much-needed rest. It also enables mothers to continue breastfeeding while ensuring their baby is sufficiently nourished. Now, let's touch on the potential hazards associated with formula supplementation. One of the concerns often raised is nipple confusion. Some believe that introducing a bottle too early can make a baby less willing to breastfeed. However, studies have shown that nipple confusion is relatively rare, and it's more often a result of poor breastfeeding technique rather than bottle supplementation itself. Another concern is the impact of formula supplementation on a mother's milk supply. The fear is that supplementing with formula may decrease milk production. However, it's important to remember that breast milk operates on a supply and demand basis. The more a baby breastfeeds, the more milk a mother's body produces. So, as long as breastfeeding continues alongside formula supplementation, most mothers can maintain their milk supply. It's also worth noting that not all formulas are created equal. The quality and composition of infant formulas have improved significantly over the years. Most formulas on the market today closely resemble the nutritional profile of breast milk and are fortified with essential vitamins and minerals. However, it's still essential for parents to make informed choices and consult with healthcare professionals when selecting a formula for their baby. So, in conclusion, whether formula supplementation of breastfed infants is helpful or hazardous ultimately depends on the particular circumstances and needs of each individual baby and mother. For some, it can be an invaluable lifeline, ensuring their baby receives adequate nutrition. For others, it may not be necessary or desired. What's crucial is open communication between parents and healthcare providers. They can work together to assess the needs of the baby, ensure proper feeding techniques, and make informed decisions that prioritize the health and well-being of both the baby and the mother. Ultimately, every parent wants what's best for their child, and the choice between breastfeeding exclusively, supplementing with formula, or a combination of both should be made without judgment or pressure.